My name is Olof Wiklund, and I am a professor emeritus in the Department of Medicine and the Wallenberg Laboratory at the University of Gothenburg, Sweden. I'm here to present to you an EAS production, Clinician's Handbook on Dyslipidemia and Atherosclerosis Prevention, Diagnosis and Treatment. Co-editors for the handbook have been Lale Tokosoglu, Maria-Rita Taskinen, and Alberico Catapano, and a number of collaborators have contributed with cases. The book is a case-oriented approach to the role of lipids and lipoproteins in atherosclerosis and cardiovascular disease, and recommendations for diagnosis and treatment. The aim of this handbook is to be a practical help in the implementation of the 2019 EAS Guidelines for Management of Dyslipidemia. Patients with different backgrounds, different levels of risk, and different clinical situations are discussed, and clinical management suggesting based on guidelines. In total, 14 typical cases are presented, going from the very high-risk patient in secondary prevention to patients with diabetes, low-risk patient in primary prevention, statin-intolerant patient, patient with familial hypercholesterolemia, patient with hypertriglyceridemia, very high appetite A levels, and the use of calcium score in risk prediction. Here is one example. This is a patient at very high risk in secondary prevention. The approach for each of the cases and clinical situation is to give a clinical background and to estimate risk and to discuss therapeutic goals in relation to risk. Further diagnostic steps and treatments are suggested. The expected results from treatment and need for additional treatment and long-term follow-up are also suggested and discussed. So where do you find the handbook? At present, the handbook is available for EAS members on the EAS website. It will in short be available on other platforms and in translation. So keep updated on the EAS website. Thank you.